Good morning, everybody. Welcome to another Mancoll Minute. Excited to have a minute to talk with you again. So again, we continue to get lots of questions, but one popped up that I feel I've answered it before, but I kind of feel like it warrants going over again. A patient had asked, what's it mean to be a board-certified plastic surgeon? What's the difference between a plastic surgeon and a cosmetic surgeon? And it can be very confusing out there. In the world of medicine, from a doctor's perspective, you go to med school, you then decide at some point in your life what you want to do as a doctor when you grow up. And a lot of times, the people that I hung out with, we were all kind of into surgery, went that way. And then even within the surgical field, when you start out, then you have other choices to make. What kind of surgeon do you want to be? Well, early on in my career, I saw how the plastic surgeons that I worked with, and really some amazing surgeons with world-renowned reputations here in Norfolk, and during my training, they were taking parts of the body and moving it around to recreate after trauma and cancer and these horrific accidents. And I was just amazed how just an understanding of anatomy would allow you to manipulate the body and understand how you can almost make something out of nothing. And it would look like a breast or a nose, or you'd have a big cancer in a cheek, and when you're done, it's still a smooth cheek. I was just fascinated by that, and I loved anatomy, and so I said, that's the direction I'm going to go. So early on, this is even before I went to my residency, a lot of what I saw in plastic surgery was all around the reconstruction. And then once I got into that field, there was this whole side of cosmetic plastic surgery or aesthetic plastic surgery, where we're using those amazing skill sets and that understanding of anatomy and saying, listen, people are changing as they get older. They're aging, their face isn't as tight and as full, and it's got lines and droops. Or women after pregnancy, their breasts would kind of get deflated, and it would affect them. It would affect them, in some cases physically, like breasts with the rashes underneath, or emotionally, they didn't feel good about themselves. And a group of plastic surgeons started veering into the direction of saying, listen, I'm going to take my skills and my knowledge of anatomy and how to do surgery, and we're going to find solutions to how to change some of these things and do it in a safe way. And then that became sort of the fabric of plastic surgery. We would take all this skill set that we were putting people back together after these horrific injuries and diseases, and now using it on an elective basis to kind of make the changes that time and lifestyle and pregnancies sort of changed. And that became the world of aesthetic plastic surgery. So from my perspective, a plastic surgeon, as a plastic surgeon that does aesthetic surgery, I am taking the 6 years of surgical training and I am translating that and applying it into the aesthetic world. Now, with that said, as a board certified plastic surgeon, that means that I've gone through all this training, I've taken the test that was 8 hours to show how much I know, and I've sat in front of a firing squad, so to speak, to answer questions and be drilled about what I know and how I would handle things. And at the end of it, passing all that, they said I'm certified to represent the world of plastic surgery. And there's about 5,500 board certified plastic surgeons in this country. The thing that happened is medical economics changed. Insurance doesn't pay what it used to pay to do a breast reduction or to do a gallbladder or to, save someone's life in the ER. So you have people who are doctors or surgeons, and sometimes actually they're not surgeons at all, but they said, hey, wait, we have some skill set, maybe not as much as a plastic surgeon, but we can take a weekend course and apply because we're smart, and get a certificate and call ourselves cosmetic surgeons, and then we'll go out there and do what plastic surgeons do, but we'll call ourselves cosmetic surgeons, and we'll sound like we're actually more specialized. But some of those folks are literally trained to be ER docs or family doctors, and nothing wrong with that. That's just their core training. But then they're taking out of their core training and going to the world of aesthetics. So in my opinion as a plastic surgeon, my worry is that the public sees cosmetic surgeon and thinks, oh, that's just like a plastic surgeon, and it really is not in so many ways. Now, there's some very good surgeons that are considered cosmetic surgeons. I'm not taking that away, but I also find that it is not the equivalent training, in my opinion. And I would encourage anybody who's looking to do aesthetics surgery to find a board certified plastic surgeon, because at the very least, they have gone through the grueling training, the anatomic and knowledge base of anywhere from 6 to 8 years in some cases of that before they ever sort of went out there, hung up a shingle and said, hey, let me do your breast enlargement or your facelift. So I believe it implies a much deeper seated training in the world of surgery, understanding the human body, the anatomy, and ultimately how to repair it. And as a rule, this is a very sought after and highly competitive residency. You tend to really get, kind of some of the best candidates going into surgery, going into the field of plastic surgery. So, like everything, do your homework, buyer beware. Don't take any one source. Look at reviews. Meet the doctor. Don't hesitate to ask tough questions. Don't be embarrassed by it, and don't hesitate to get multiple opinions. Sometimes a little investment and a few consultations to find the doctor that you mix with and you have the best rapport with is worth every bit of that time and whatever little bit of money might be associated with it. So hopefully that clarifies some things for you. Have a great weekend. Look forward to you coming in. Give me a call anytime if you have any questions about the things we do. Great night.